advertising.
Earlier in the show, we were chatting about Pet Dental Month, but we can't forget about our own smile. Dr. Andrea Smith is here to fill us in on mini dental implants and why they're popular and they're a big choice for her patients. Welcome back to the show.
Thank you, Aubrey. Thank you for having me again.
For folks who aren't familiar with mini dental implants, can you explain the concept?
Yes, the concept is a mini dental implant is a smaller diameter implant used to replace missing teeth or also to stabilize or secure dentures.
What kind of benefits can people get from getting mini dental implants?
The main benefit of a mini dental implant is that the surgery is less invasive. We no longer have to do a lot of surgery in order to get the implant in place. And the second benefit is that the mini dental implant is one piece. And what that means is on the day of insertion, the tooth or the dentures can be placed or stabilized immediately.
And this is like a modern way of doing it, because I guess sometimes when people think about the old school way of doing things, it's a little scary.
Yes, and it's more modern mainly because of its less invasive nature. Surgeries everywhere are being done less invasively, whether it's a knee surgery or a heart surgery. So in keeping in that trend with minimally invasive surgery, mini dental implants are modern in that way.
And this is something that you specialize in. Why is that?
Well, what attracted me to it was my patients who often wanted to receive dental implants, but yet were found in a position where they couldn't receive them. Either they didn't have enough bone or the price for them was just out of reach. With this technology, the amount of bone that's required is a lot less, and it's a lot less costly because the surgery is a little less invasive, and the time to place the implants is a lot shorter.
Right, it sounds like it could be a great option for people who, you know, didn't want to go another route. And I see on your top here it says diplomat. What does that mean?
Well, I am a member of the International Academy of Mini Dental Implants, and I am a diplomat in the Academy, and that's just a reflection of my level of experience. I've done about 7,000 mini dental implants. I've published in our trade journals. I've lectured to dentists who are new to dental implants, and I've also received awards for my work in mini dental implants as well.
And what types of things are you hearing from your clients? You know, you see them when they come in first, and then you give them a finished product. What kinds of things are they saying?
I often hear that it's life-changing for them, and the dental experience of receiving a mini dental implant is a lot less invasive than some of the other treatments like root canals. Rarely have I had a patient who received a root canal get up and hug me and cry and say, "You've changed my life." The root canal is a lot more difficult, but yet the dental implant is a lot more rewarding and less difficult to do.
Right, I mean, it's cosmetic, it's functional. Let's hear what some of your patients have had to say.
Absolutely.
Amazing. I'm so happy to be able to chew, to smile with confidence, and above all things, once again, chew peanuts and gum without having to worry about anything falling apart.
I'm sure that you hear a lot of praise, and like you were mentioning, people hug you.
Absolutely, they definitely hug me, and just the ability to eat and chew, as that patient said, it's really life-changing for them.
Oh my goodness. And who are the patients that really benefit from this the most?
I think the primary beneficiary is that patient who has been wearing a lower denture for a lot of years. That denture starts to slip and slide because over the years you lose bone as there's no longer teeth in that in those positions. And so the mini dental implants are placed into the jawbone, and then that denture can be snapped into place, allow them to eat, chew, and smile with confidence.
And what about the upkeep on them?
The upkeep is just like normal dentistry. You'll want to see your dentist every 6 months. You'll want to brush and floss every day. You'll want to use a water pick and things of that nature. And we educate our patients on how to take care of them as well.
And I'm sure when someone comes in, you're going to walk them through the process and make sure that they really understand what's going on.
Absolutely. We spend a lot of time doing that. It starts at the consultation visit where we do a complimentary CT examination, and then I do a clinical examination, and then I just tell them what their possibilities are. And after that, we receive, of course, informed consent, and we normally go through with the process.
So someone's out there watching and they're thinking, I don't know. What can you say to make them take that step? Is it an easy process?
It's a fairly easy process, but I will say just last week after leaving the show, there were 2 patients in my office waiting to receive a consultation. They had seen a previous show and they saw me that morning as well, and both of them walked out with teeth that same day. It was just a single missing tooth in both cases, and they were just amazed at how quickly I was able to do that for them.
I love it. She's making everybody smile. Thanks for being here.
Thank you so much
for more information, you can call 916-482-8300 or visit smileagainnow.com. Up next, John Bartel.